So let's study today about brachial plexus. What is mean by brachial plexus? Plexus means network of nerves. Network of nerves which locate in the brachial area. What is brachial area? In the arm, which also known as brachium. We can say brachium or arm. Okay. So let's start the brachial plexus. From where its origin? Its origin from ventral rami of C5 to T1. Okay, in the cervical, we have already studied. We have spinal nerves, we have thoracic nerves, we have lumbar nerves. So from there, this is cervical region. So it is originating from the ventral rami. Okay, from C5 to T1. Okay, so it have 5 parts. Which parts are they? It's easy to learn. We have root mainly, then trunk, then division, then cords, and then branches. Okay, R, T, D, C, B. Okay, root, trunk, division, cords, and branches. So let's start to learn how our brachial plexus is formed. So from root we have said C5, C6, C7, C8 and T1. Okay, so 1 and C5, C6, C7, C8, T1, they will merge and give one trunk. This is upper trunk. C7 will go as it is. It will form middle trunk. And the lower trunk by C8 and T1. Okay. Now, how division is formed? Each and every trunk will divide into 2. Anterior division and posterior division. Anterior division and posterior division. Anterior division and posterior division. So this is the division part. Okay, now comes cord. Cords is very interesting. Cords, like, we will connect every posterior division in one. This will become posterior cord. Okay, now how lateral cord is formed? Lateral cord is formed by anterior division of upper trunk and anterior division of middle trunk. Do you see? I am saying only anterior division and anterior division of middle trunk. Upper and middle will form lateral cord. Now we only left lower trunk anterior division. Posterior is already done to posterior cord. Okay, so let's do about anterior division of lower trunk. This will form medial cord. Now we'll have only left branches over there. So how branches is formed? We have some good mnemonics, we can say, or good idea. From medial we have M4U. Okay, so 4M, 1, 2, 3, 4 and U. For posterior we have L, U, N, A, R, lunar. There will be 5 branches in posterior cord, L, U, N, A, R. And in the lateral cord, what we are having? There will be L, M, L. So let's name them. Okay. From L, lateral pectoral nerve. Again, L comes lateral branch, or we can say lateral root to median nerve. Okay, median nerve have two branches, lateral and medial. Okay, now M is left. From M, we will learn musculocutaneous nerve. I will write only N. Okay, musculocutaneous nerve. Now comes, after lateral, we will do median. Median is easy. Okay, M, we have done here lateral, so here will be median. This is lateral pectoral nerve. This will be median, of course, median pectoral nerve. Here is lateral root of median nerve. Here will be median root of median root to median nerve. Medial root to median nerve. Okay, and then to M left, there will be also median. Median, this will be also median. It's medial. Okay, medial cutaneous nerve of arm. It will supply only cutaneous part, okay, below the that skin, okay, skin part of the arm, and this will be medial cutaneous nerve of forearm. One will go to arm, again another will go to forearm. Left U. U is easiest, ulnar nerve. We all knows we have ulnar nerve in our hand. So M for medial pectoral nerve, M for medial root to median nerve, M for medial cutaneous of arm, and M medial cutaneous of forearm. Left U, U for ulnar nerve. Now we have posterior cord left. We have 5 branches from posterior cord. It is lunar branches. Let's do what is lunar branches. Okay. From L, what do you think? What will come? Okay, let's do from L is lower subscapular nerve. Okay, a lower branch of subscapular nerve. Subscapular, scapula below, subscapular nerve. Okay, from you, this is upper, this will be lower. Upper subscapular nerve. Okay, now NAR, nerve 2, latissimus dorsi. We all know we have a muscle of in the back. It's latissimus dorsi, which is getting supply from posterior cord divisions. Posterior cord, okay, and from posterior division upper trunk. Now axillary nerve. A for axillary. Axillary nerve. And we have left one now. It will be, of course, radial nerve. So we have done branches which are originating from cords. Lateral cords, lateral pectoral nerve, and musculocutaneous nerve. L, lateral root of median nerve. Posterior cord, lunar branches. L, lower subscapular nerve. U, upper subscapular nerve, and nerve to latissimus dorsi. A, axillary nerve, and R, radial nerve. Medial cord, we have 4 M and 1 U. M, medial pectoral nerve, M, medial root to median nerve, M, medial cutaneous of arm, M, medial cutaneous of forearm, and left U, ulnar nerve. We also have some branches. I'm saying branches which are not originating from cord. Other than cords, we also have some branches which is originating from trunk. Yes, trunk. Upper trunk, we have two branches. Okay, which nerve? Suprascapular nerve. Okay, suprascapular nerve. This is subscapular nerve. Here is suprascapular nerve. And the next nerve is nerve 2, subclavius muscle. Subclavius, okay, subclavian muscle. Okay, you can say. This is our clavicle. The muscle located below the clavicle is subclavian muscle or subclavius muscle. Okay. Now next, we have two more branches which is coming from root. We have done upper trunk, right? Now it is C5 root. Which nerve it can be? It is dorsal scapularis. Okay, dorsal scapularis nerve. And we have one more branches, one which is origin from our 3 root. This is the longest nerve, named as long thoracic nerve. So we are done here. Understood? Now this is our brachial plexus. Now we'll go to, here are some points to notice that we have branches from lateral cord, posterior cord, medial cord, from upper trunk, from dorsal from C5, C6, C7 root, but we don't have any other branches from divisions. See, we don't have any branches from divisions. Okay. So here, now the turn is to learn about their root value. What are the root value of them? So if we'll see here, so if you'll see the lateral cord muscles, what are their root value? It's easy to find. If you will trace it like this, okay, what's coming? C5, C6, yeah, and if you come here, it is C7. So it's easy. C5, C6, C7. This is the root value of lateral branches. Okay. Now we have medial cord branches, posterior cord branches. If in medial cord, let's trace medial cord. From medial, these C8, T1. It's easy, right? We have C8 and T1. But there is one exception. C8 and T1 is only for these 4M muscles. For ulnar muscles, we have also one exception. It is also getting supply from C1. Okay. And then comes posterior cord muscles. It's easy to learn here. C7 nerves is extra other than C8 and T1 for ulnar nerve. Okay, this is exception case. So now posterior cord. In posterior cord, here there is some taking other color. Okay. So here L, U and A muscles, nerves. L, U, A. These are coming from C5 and C6. Okay. L, U, and A, they are coming from C5 and C6 only. Now comes N. Here is N muscle, and nerve. N is nerve to latissimus dorsi. It will come from C5, no, C6, C7, and C8. Okay, C6, C7, C8 comes radial nerve. Radial nerve is the longest nerve in our hand, so it is getting supply from all of the root C5, C6, C7, C8, and T1. This is for nerve to latissimus dorsi. Understood? So this is our brachial plexus and its root value. But here is some clinical aspects of it. Let's study about clinical aspects. Erb's palsy. What is Erb's palsy? There is a Erb's point. Erb's point. What is Erb's point? This is this point. Okay, this point is Erb's point. Here 6 nerves are getting 1, 2, 3, 4, 5, and 6. Let's do it clearly. I'll make a separate diagram. C5, C6. Okay, they are coming and getting a joint and giving anterior division, posterior division, and 2 nerves are coming here. First is, yes, suprascapularis nerve. Second is nerve to subclavius muscle. Okay, so let's count it. 1, first root. Okay, second, upper trunk is the upper trunk suprascapularis nerve. Here fourth, anterior division, and here posterior division. These are 6 nerve. Okay, meet at the upper trunk. This point is Erb's point. Okay, if there is any injury at this point, it will cause Erb's palsy. In Erb's palsy, what will happen? There will be adduction. Okay, adduction of our arm. This is arm. This is got adducted. Okay, and medially rotated. Arm will be adducted. Okay, adduction at arm. Adduction and medially rotated. And what will happen? The elbow will be extend outside. Okay, next forearm. What will happen to our forearm? It will be pronated. Fingers will be flexed. If we'll do this on our body, it will something look like this boy's hands. Okay, this boy's hands. And see, if we look at him, this is a sign. We named it policeman's tape. Policeman took tape now, so it's named as policeman's tape hand, or waiter's tip hand, or porter's tip hand. Okay, so Erb's palsy or is a palsy at the Erb's point. What is the Erb's point? A nerve where of the upper trunk, a place where the upper trunk, all these 6 nerves comes and joined. This is the Erb's point. If any injury happened to this Erb's point, it will have at arm adduction and medially rotated. Elbow will be extend out. Okay, forearm will be pronated and finger is flexed. So this is a sign which can be known as policeman's tip hand. If a patient comes to you with this sign, okay, better tip hand or porter's tip hand, it is really a Erb's palsy. Okay, now we have one more palsy. It's Klumpke's palsy. Okay, what happened in this? This will be lower trunk injury. Where is the lower trunk? In this is the lower trunk. If in this place have any injury, this is Klumpke's. If upper one, this is Erb's palsy. Okay, in this what will happen? Two roads are involving, right? C8 and T1. C8 and T1. C8 and T1 is injured. So, which nerves are getting here? The nerve will be affected will be ulnar nerve and median nerve. Okay, and in this there will be claw hand sign. Claw. How we will form a claw? Here, claw how is formed? See, if we will hyper extend our metacarpal phalangeal joint. Okay, do it at your hand. Extend your metacarpophalangeal joint. Okay, and then what will you do? Flexion where? At interphalangeal joint. Okay, hyperextend at metacarpophalangeal joint and flexion at the interphalangeal joint. So this will be claw. You will have the claw hand features. Understood? Now, Horner's syndrome. There is Horner's syndrome. If, for example, this is first I'll write Horner's syndrome. If I can say patient comes to me, if there is only he or she can have Horner syndrome, how we will say? In Horner syndrome, T1 will not involved. Okay. In this T1 is not involved. If there will be, if it will be there, so it will have. So in Klumpke's. Claw hand, ulnar nerve and median nerve will be affected, plus Horner syndrome will be there. But what is Horner syndrome? In that, Horner syndrome is about T1. Okay, T1. There will be, for example, if the patient is only having T1 affected, and it will show some sympathetic causes. Okay, that is Horner syndrome. In Klumpke's, T8 is also involved. C8 is also involved, and T1 is also involved. So both the features is seen in the Klumpke's palsy. So till here we have our topic. So if you have any query, do comment and subscribe for more.